Joining me now, Graham Thompson, who is one of the founders of Global Health News Network. Graham, so nice to talk to you today.
Nice to talk to you too, Sabrina.
You have a really interesting background. I was looking through and you've done so many different things. Talk about some of the experiences you've had, some of the, kind of how your career has taken this unique path and the intersection with your passion for global health.
Thank you. There are two or three threads to this. First of all, I would say that I've been interested and involved in news, journalism, broadcast news, and also the evolution of digital broadcasting over the last 20 years. And in that respect, communications has always been important to me. Communications and the way we communicate through these different modes. That's one thread. The second thread is that I was a founder of a charity in the UK about 15 years ago. This is a charity now that's going pretty well, sadly, because we wish we had a cure for Parkinson's disease years ago. But 15 years ago, my late father-in-law developed Parkinson's disease, and he and I and some others founded a charity called the Cure Parkinson's Trust. Our aim was to find a cure for Parkinson's in 5 years. We're not there yet, but that desire to connect people to find new solutions to old problems is a particularly difficult one in the field of medical research. I found that out through first-hand experience. But when you are able to bring people from disparate medical and research backgrounds together, and you're able to enable them to communicate more powerfully, then new things happen. And I think that leads me to the third thread of my interest, or what's led me to this, and that is my long-term interest in how teams work, how leaders perform, and how collaboration leads to new ideas, no matter what the field. That was a company I was involved in for about 15 years out of New York City. Those three threads and meeting other people, to my point a couple of moments ago, have led to the genesis, I suppose, of the Global Health News Network. And those intersections of other people, primarily Charles, Roxanne. Let me just finish off that, Sabrina, by saying the nexus of people, ideas, thinking, and a need is what drives me. The idea of creative tension leading to breakthroughs, the idea of collaborative innovation leading to new breakthroughs and new ideas, and simply the need in the field we're talking about of healthcare and clinical excellence, of people being able to communicate, whether it's very complex clinical ideas or whether it's very simple health-related advice. In our new technological age, we're now able to communicate these things much more easily using the thing I'm talking to you on, my smartphone. I was looking for it here and there. I'm talking to it right in front of me. I work a lot in India in another field. 20 years ago, when I was working in a different field in telecommunications, somebody who wanted to talk to somebody in the next village, let alone on the other side of the world, if they could, they would go to a telephone at the end of the village. They would pick up that telephone that was a landline telephone, put money in it, and try and talk to somebody somewhere else in the world. And one person in the village of 500 people might be able to do that once a day. Now, everybody in India, and I travel in India a lot, pretty much has a smartphone. That means they have access to medical advice, medical help, medical assistance, healthcare advice, diet, whatever it might be. Our desire is to integrate and curate a lot of this information, this knowledge, this wisdom that is available around the world, exponentially growing every day, and make it available to anybody who needs it, wherever they need it, whenever they need it, be they a clinician or somebody living in a village wanting clean water somewhere in Somalia.
You know, you bring up a good point. You talk about almost everybody having access to a smartphone now. There is already a lot of information online, a lot of health information online. So, what would make Global Health News Network different? Because you can access on certain websites, you can do a search and you can pull up a topic, a health related topic that you want to find out some information on. So uh, what makes it unique?
Very good question. I think it comes down to one thing: trust. Yes, there is an enormous amount of information about everything available on YouTube or on a browser somewhere. And as you say, many people have access to all of that information. What they don't have is knowledge and confidence that what they are reading or what they are viewing is trustworthy. Is it correct? Is it going to help them or kill them? Is it going to waste their time or lead them in the right direction? So the ability to be able to trust what you're seeing is critical to the communication process. That's the same when you're watching your evening news or when you're on a Twitter feed. Mm-hmm. Can you trust what you're seeing? Global Health News Network plans to curate and moderate the content, one, that we gather and integrate from many sources around the world, and secondly, be able to generate our own content, whether it be clinically focused or administrator focused or consumer or patient focused, that we can trust and that the viewer can trust. And remember, this is primarily about video content. Now, as I said, you can go to YouTube and watch 1,000 videos on knee surgery or rehabilitating your knee or COVID-19 for that matter. How much of it can you trust? How much of it is going to tell you that you're in danger of getting COVID-19 if you stand near a 5G mast? Or how much can you trust if somebody tells you that you need to wear a mask covering because it's an airborne virus? It's those kinds of simple and at the same time very complex questions that we want to be able to address.
And just as the name implies, Global Health News Network, this is for everyone, correct?
Yes, correct. From the clinician who is a heart surgeon wanting to share his online video of procedures with other clinicians in the same field, or whether it's an administrator in a hospital system or in a small GP surgery somewhere around the world who needs to be able to have access to best practice and other colleagues' knowledge and understanding of how to be effective and efficient in running whatever they're managing. Or it might be somebody who's recovering from heart surgery, or somebody who's recovering from knee surgery, or somebody who's had cancer treatment, or their families who need support, who need assistance, who need help, but it may be difficult for them or out of their realm of financial wherewithal to be able to access it in a normal face-to-face setting. This is something that will allow them to be able to access that trusted support, knowledge, care, and understanding. And what's more, we plan this to be also an interactive network so that when you are a member of it, when you are associated with it, you will also be able to interact with those others who are part of it. So it's a two-way interactive conversation, or a many-way interactive conversation that we want to generate among those people who come to us.
Graham, we are almost out of time. Before we go, anything else we should know about Global Health News Network? Sounds like you have a lot of passion behind it.
I do have a lot of passion for this. I think it's an idea whose time has come. When we were first talking about the idea and talking to others about the idea, one of our first questions is, well, this seems so obvious. Why has nobody else done it in the past? Now, in the course of our research, I think we've found that people have had attempts at doing this, and some people are doing great work and creating great content, but it's primarily unintegrated, dispersed, unmanaged, and therefore not fully trustworthy, in the sense of what I was saying before about generating content integrated, curated, and trusted. If we can do that, and when we do that, we'll be able to draw all of that other content in a way that's never been done before. Nobody's attempted to integrate it in this way and in this format that's primarily focused on video content that's easily digestible by people. There's tons of stuff that's available on web browsers, but it's difficult to find, it's difficult to understand. Video content is different to that, and also podcasts, which are growing exponentially as well in their popularity, whether they're video or audio podcasts. These make the content and sometimes very complex ideas simple to digest, simple to understand, and simple to act upon. So I hope that Sabrina answers part of your question at least, and we're very much looking forward to bringing other people that are as passionate as me and my other founder colleagues into the fold, into the team, and creating something new.
Graham Thompson, it's great to talk to you today.
Thank you, Sabrina.
Joining me now is Roderick Cameron, who is one of the founding members of Global Health News Network. Roddy, so nice to talk to you today.
I'd love to talk to you too.
Roddy, tell me a little bit about your background and how it has helped shaped you and your passion for global health.
My journey to this point is I've been through a sort of series of steps. I was a corporate lawyer in my first career. I've been through an MBA process to move into financial communications in UK and in Africa. I spent the last 6-8 years in advising small and scaling businesses to grow. So I met the team and it's initially the transatlantic team, really to help them pin down what this project could be and help them turn it into a more robust proposition. Because at the heart of what they were doing, what attracted me to the project, is this notion that the absence of a really trusted global source for healthcare medical information.
And you hit on something when you say trusted, because you and I, and quite frankly, anyone with access to a smartphone or with a computer can do a search, and you can pull up anything, topics on, cancer prevention, knee surgery, heart disease, you name it. There's so many different, websites that offer health information. So is that the difference, the trust component? I mean, because you can access this information. Sometimes it takes a little bit of digging, but you can find it. So why a network devoted to global health?
I think there's a couple of layers to it. If we take the trusted news, I don't need to share with anyone how much distrust there is around news from official sources. It doesn't matter which jurisdiction you're sitting in. People are uncertain. And the proliferation of news sources that's come around with social media, internet, and so on, has driven a lot of reliance back to those trusted resources. And I know sort of externally that the BBC, for instance, is still seen as a very solid and trusted worldwide brand for general news, Bloomberg for financial news. But there is definitely a gap as the go-to starting point for health and medical information. The next layer down really is about matching sort of medical provenance with editorial integrity. This stuff really matters. It impacts life choices and lives ultimately. And therefore, there's going to be really quite a high bar of probity and trust and integrity in that information if medical professionals are ultimately going to be making decisions informed by that information. So one of the key bits we've been keen to do is address a structure that allows that medical probity, editorial integrity to live alongside a proper business model that allows the right investment and revenue generation to create the proper infrastructure to make sure we got the best information delivered in the most accessible way.
Who is the audience for Global Health News Network? Is it people like you and me who just want to find information? What about people in the, health professional field? Would someone like a doctor or some kind of health professional also turn to Global Health News Network to find out some information? Will there be deep dives on particular topics?
Yes, I think core really is the medical professional, which goes right at the heart from doctors, MDs, to those working in healthcare, healthcare administration. You start to go quite broadly out with those who've got a sophisticated interest. Now, that trickles down and is that of interest to patients at one end, understanding better what the theory is around their medical condition. Well, absolutely. But if we're pitching our tent right at the medical professional first, that level of sophistication, and as we broaden out the offer, then people like me as a patient or someone interested in healthcare developments, yes, there'll be content for me, but we have to make sure that we have the attention and the quality of information that those professionals deserve. If I think about my time in financial markets, for instance, Bloomberg, Reuters, absolutely top-level sources that were trusted to make big decisions on, and those organizations were made, absolutely sure that they were getting the right quality of information into the top end, into the hands of the professionals. As information is democratized in the last couple of decades, sure, those markets actually are very, very big, and a lot of people will want to access that information. But if at its heart, we get it right for the medical professional, then everything else will follow from there.
And I'm not in the medical field, so this would be a question that I would ask. It sounds like there is, no sort of platform right now on a very large scale where medical professionals can share this information, where you can harness, the expertise of professionals and share that, on a massive scale.
Indeed, I think that there's a number of smaller networks, often geography-specific or even regional-specific, or a particular type of medicine or healthcare interest. We're really looking to kind of put an umbrella over the top of what they do and anchor it in one place, so that material is findable. To be, it's the brand that matters. We have to get the brand right, that people understand where we sit in the system, that right at the top in terms of quality and integrity of output, and that is the place that people can come to get the best quality information. And there's lots of people out there recognizing the need for this. We think we've got both the ambition to be global in scale ultimately, but also our particular structure involving a foundation right at the core of the structure of what we do that takes responsibility for the medical integrity and the editorial integrity, that really built that into our DNA, to use a medical term, will give us a very different license to operate and allow us to access and integrate with both medical bodies, whether those are hospitals or health organizations, will recognize that we're a trusted partner for them.
As I touched a little bit on your background, or you kind of expanded on your background, you have colleagues in this, right? Other founding members of Global Health News Network,
Yeah.
and you each bring something different to the table. I mean, you all have very, very different backgrounds. How do you think that benefits in the creation of this network?
It's been a most enjoyable journey simply because of those different skill sets and different views. All of us actually having quite a global outlook, no matter which part of the globe we're sitting in. And so everything from that deeply embedded knowledge of how the healthcare and medical system works and what the needs are that Kimberly and Chuck started kicking around these ideas, saying, why isn't there this? Through to meeting with them, getting Graham involved and myself involved to work out how we turn these ideas into both the brand and the business model that can succeed where others have feared to tread. We think we've got particular ways of pooling our knowledge and insight that we have been able to create an unusual structure, but also will allow us to grow very quickly with the trust of that medical healthcare community.
Roddy, is there anything I didn't ask you about the network that you think we should know, or about your background or passion and interest in really providing this platform on a global scale so people can be educated about health?
Well, ultimately, all the great businesses do have that sense of higher purpose. And actually, at the heart of this is a desire to get the best quality of medical information, democratize that, get into the hands of the right medical profession anywhere in the world. Our cell phones have changed everything. One of the next generations of how we use these devices is really about the quality of information and getting that out. We've seen the volume of information, certainly, but how do we improve the accuracy and the quality of that and learn from each other? And so purpose is certainly very much at the heart of that democratization of medical information and building a bigger community globally to make sure the best and the latest thinking is disseminated and dispersed to save people's lives and give people better outcomes for their medical care.
Roddy Cameron, it's great to talk to you today. Thank you so much.
Really enjoyed that. Thank you very much, Sabrina. Bye-bye.
Joining me now is Chuck Roxon, who is one of the founding members of Global Health News Network. Chuck, nice to see you.
Good to be here. Thank you.
You have quite the resume when it comes to consulting and the healthcare industry. Explain how your background lends itself to being one of the founding members in launching this network.
Well, we've been involved in consulting to the healthcare industry, all sectors, for well over 3 decades now. That includes from helping to negotiate health systems mergers down to working with deploying visiting nurses in the field. We've worked with small clinics, large clinics, National Institute of Health. So we have a very wide experience in the healthcare industry.
Something I found very interesting also about your background is you've got somewhat of a news background too. So in launching a news network with a focus on global news, it sounds like something just naturally for you.
Well, as a matter of fact, the very first year that we had public television in my hometown in Western New York. I was on a show, unrehearsed, live, and it was really a lot of fun. So one way or another, I've been involved with media over the decades. Yes.
Talk a little bit about the idea of the network, because I can go on a search engine, I can find health news, I can do a search, I can find something on colon cancer or emphysema or the latest in the fight against, malaria. So there is information out there. It may not be all presented to me in the form of some kind of network or a show, but the information is out there. So why a network focused on global health, and what would make this type of show or the pieces of information inside of it, what would make it so different?
No, thank you for that question. That's really key to what we're doing. I think that the reaction to the recent pandemic shows that the public is really quite hungry for good, solid news, and the networks have really met that need. They've ramped up very quickly in their expertise in being able to report health news. I also know that when the pandemic goes away, that the demand for this news will still be there, but it won't be their market, so to speak, which is breaking news. We had several teams from Seattle University researching this very issue. And one of the things that we found out is that when we do an internet search, almost 90% of the material that you can access worldwide is either obsolete or has not been clinically validated. It's astonishing how much misleading information there is. So at the Global Health News Network, we want to have trusted, vetted information that when you go to it, you can say, I have pretty high confidence that what I'm getting is good information. We're going to establish a parallel foundation, which will be independent of us, a not-for-profit foundation composed of scientists, clinicians, as well as media experts on ethics, who can advise us and also make sure that what we are presenting the public is the most beneficial news and information they can receive.
It sounds like you're tapping into resources and existing trusted partnerships. Can you give me an example of perhaps an organization you might be working with, or a different kind of partnership that really lends itself to this type of network?
Yeah, I can mention two right offhand. One is MedVarsity, which is located in India and is actually the world's largest producer of medical clinical training videos. Recently, they developed with Boston Children's Hospital a simulator for ventilators for people who are needed in hospitals to work with COVID patients, but they haven't had training. And it worked brilliantly. It's the greatest use of simulation, video simulation, and AI I've seen. Fabulous. So we're really proud of our relationship with them. The digital health division of the World Health Organization has also made information available to us. Now, the public is beginning to catch on to the fact that there's a difference between science that is fixed for all time and science that evolves. And science evolves. The science that we knew 100 years ago is not the same as now. We want to make sure that when we track the evolution of what's going on in healthcare, that it's the latest, most validated information you can get your hands on.
The network is for everyone, everywhere. So as a layperson, I can tune in to the network and get information that I'm seeking. Are there other audiences besides a layperson that could really benefit from accessing the network and receiving that information?
Yes, and we definitely intend to make clinical training information available as well from a variety of sources. We've already started getting prices on that, so we're going to know how to do that to help train people everywhere. And then the other thing is, you get out your phone. We want to make sure that my doctor can put a video on my chart. When I log in, there is something explaining what I need to do, so it's there for me. We have that capability now, and we're just beginning to amass the information to make available.
So it's more than just the layperson, absorbing this information. It's actually putting it into good use. I mean, action is associated with it. And you talk about the training. So there's also the healthcare professional to healthcare professional peer learning going on. Is that an accurate way of describing it?
Correct. Yeah. So it's a wide spectrum, and we have already started to build an ecosystem and a network of professionals that is wide and deep. We have a really good technical advisory board and scientific advisory board that we've already started to build, and we're going to keep building this until we have unassailable help to make sure that we give you the best that you can possibly get.
Before we close, Chuck, any final thoughts?
Yes. The music that we have used to open our news broadcast, I thought about it and I originally picked it out. I was a musician when I was younger. And it's the fanfare to the opening of Paul Dukas' tone poem La Pairie. Anyway, I was on the internet looking for a good version of it to use, and I found a version that was recorded by the brass of the San Francisco Symphony very recently from their homes, their living rooms, their home offices, and they did this online. It's a fabulous performance. They're a great group of musicians. In any case, they did this specifically to celebrate the work of the healthcare workers who have been on the front lines during the pandemic. And it's just perfect. I want to thank them so much.
Beautiful and very fitting. Chuck Roxon, thanks so much for speaking with us.
Thank you for doing it.
And joining me now is one of the founders of Global Health News Network, Kimberly Brecko. Kimberly, so great to talk to you today.
Oh, it's great to talk to you today too, Sabrina. Thank you.
Tell us a little bit about your background, because you have been an international business owner for almost 25 years. You've had a lot of global clients, including hospitals and healthcare companies. So how does your background position you well in launching this network?
Well, it is true that I'm a bit of a serial entrepreneur. My brain just kind of thinks on constant startup mode. So in listening to my clients over the last decade plus, especially in the current business that we're in, we've really discovered a lot of needs around healthcare. A particular passion of mine is really bringing together people and experiences, and hopefully improving experiences. So my original background comes from Nike at the world headquarters. And of course, they're all about excellence. So it's no surprise that my brain kind of thinks that way a little bit. My current position is of CEO of Eco Digital Media. And we are a digital marketing company with a huge emphasis in healthcare, as I mentioned. We were sitting there literally with one of the largest healthcare systems when Chuck and I broke into this light bulb moment of, wow, there's a need for trusted content. Wow, there's a need for distribution and for maybe even storage. And how do people get a hold of this great information? Well, I have to say my experience, again, coming back to Eco Digital Media and visual electronic displays, really just kind of, we just couldn't quit talking about it after that. And GHNN was soon born after.
You mentioned trusted information, and I want to hone in on that because there's a lot of information out there on the internet. You can do a search and find, anything from breast cancer therapies to, the latest research on Parkinson's, or, I've got something wrong with my lower back. What can I do? What kind of, alternative therapies can I do aside from, surgery or something like that? So you've got all this information out there. And yet, I think if you polled many people, they would say, well, I trust certain sources. I don't trust every source. But there is all that information. So how would this network be different?
Well, that's a really good question and something that we've spent a lot of time on. And I think the thing that it comes down to is that science and information evolves over time. It's not a one and done kind of a thing. And people really want to know that they can trust exactly what they're reading at the time. And while things might be current at one moment in time, they could change the very next week. And it could change based on new testing, new analytics, new ways of looking at things. Really, what I like to see is that even well-known sources can be financed by third-party companies, or could be financed by somebody that might skew the findings that they are actually studying. That's what GHN is really trying to get away from. And part of the way we're doing that is by structuring it so that we have a nonprofit arm over the top of everything that owns the content, verifies and curates all of our content on an ongoing basis.
It sounds like there is a firm commitment to really vet this news. You will have at your disposal leading experts in their fields, in their respective health fields. You will also be engaging with and utilizing the skills of some top journalists to make sure that this information is vetted. Am I hearing that commitment?
Absolutely. Curation and vetting information and making known the source of it is really all of that's what we look at as our soup, really. And that's what we want to create, a gathering place for people to rely on that type of information, whether it's through the streaming news network or whether it's through the platform that we will have for consumers and professionals alike. Those are just crucial components that for me are missing. Even when I do a search online, I don't know what information to trust at any given time. And we've all had personal experiences that are, either urgent or just we really want to take care of ourselves better and have an ongoing plan for our well-being. My own personal story goes back to when I was a child, and my father had many, many large health episodes throughout his life. And with all of those challenges, what was clear is that it was very hard to connect our family because we all lived apart. And managing those conversations, whoever was the nearest was the one responsible for the information, whether or not you're sitting in the doctor's office or not with that person. But having a platform where you could all gather and actually get information, create a plan together, and then support from wherever you are, your loved one, I think is really one of those things that kind of reaches me at the core.
As a digital content and platform expert, this is really your area of expertise. And I think that's important to touch on because you're looking at informing, engaging, even maybe in some cases inspiring a global audience. Is that correct? You're thinking of, delivering this latest information to people in Africa. It might be people in Europe and people in America and just all over the globe. So talk about how, digitally you're able to do that.
Absolutely. I met my co-founders through Chuck, who was my right hand at the time. When we sat there and looked at this as a business, we realized immediately this is way bigger than us, and we wanted it to be. So he brought in some partners from the UK, and that's how the four co-founders came together. We just, we kind of figured, well, starting with the English language is a natural place to begin for us, and branching out from there to other countries is really going to be our key growth. And also just, it's needed for the conversation because experts come from everywhere. They don't just come from one country or state. And with our global platform, peer-to-peer, consumer to patient, whatever the combination of people are, they will have a place to gather on the platform that will not only bring them together, it will lead to best solutions, best practices, best science. And again, going through our curated process of verification is really what at all those levels we will be addressing. With that said, different countries can bring in different components of what is, the right thing in any given conversation. That's why we believe that having that global effect is going to be so key to our conversation.
Kimberly Brecko, great to talk to you today. Thank you so much.
Thank you. I appreciate it, Sabrina.